everybody, it's Dr. Newman, and I'm coming to talk to you today about common medications and patients with renal injury. Primarily, we'll be talking about patients with renal failure. Medications that are common to dialysis patients usually include vitamins. You'll see that they are taking water-soluble vitamins. It's important for you to also know that they'll be taking phosphate binders. Whenever you're taking care of a patient that's on dialysis of any sort, you'll want to be sure to give these phosphate binders with their meals if they're eating. Common phosphate binders are Phoslo, which is calcium acetate, Renagel, which is cevilamine hydrochloride, and Caltrate, which is calcium carbonate. Now, about calcium carbonate, you want to make sure that you're not giving any type of calcium with an iron supplement, which almost all dialysis patients are on, and we'll get to why they're on those in just a few minutes. But you'll want to make sure that you're not giving calcium and iron together, because calcium inhibits the absorption of the iron. You want to make sure that you don't give the iron with a phosphate binder as well. Be careful of antihypertensives, because if you give a patient an antihypertensive prior to dialysis, and they go to dialysis and have a large volume of fluid removed, then their blood pressure will likely go down as a natural result of removing that fluid. So if you've given them an antihypertensive, they go to the dialysis and have fluid removed and become even naturally hypotensive, then they could have a hypotensive crisis and therefore require further treatments to boost their volume back up, which negates the purpose of the dialysis. Other medications that are common to the dialysis patient are erythropoietin. This leads into the anemia that's often experienced by dialysis patients and explains why they might need iron supplements. Refer back to your physiology and your anatomy videos to talk more about or learn more about the function of the kidney in relation to erythropoietin and the production of red blood cells. We've talked a little bit about calcium supplements, but I want to make sure that you understand to give calcium between meals and not with iron. So spacing of medications with renal patients is very important. Patients that are taking the calcium supplements will also be given activated vitamin D3. This helps to aid in the absorption of the calcium. Oftentimes you'll see patients on dialysis of some sort will be given an antibiotic. You'll need to make sure to check the frequency of that antibiotic, and if it's a daily medication, you'll want to hold that antibiotic until after their dialysis, because if you give it before, then the effect will be limited or non-existent if the medication is dialyzed out whenever the patient undergoes their treatment. Many medications and their metabolites are excreted by the kidneys. You're familiar with this. I've provided you with several lists of medications that are impacted by patients that have acute kidney injury. Primarily, you'll want to make sure that you understand that dosages may be adjusted or might have to be adjusted because the patient has acute kidney injury or has renal failure. This is because their body's not able to metabolize that medication in the same way and not able to get rid of it or not able to excrete the metabolites that are created from the absorption of that medication. A lot of medications will need to be adjusted in their dosage. We talked about that a little bit. The pharmacist that's following the patient in a hospital setting will usually make those adjustments, and if you're in an outpatient setting, those adjustments will be made by the physician or the mid-level provider. Always check your drug book for advice related to renal patients and their medications. Other resources are the hemodialysis nurse and also the physician. If I personally have a question about whether to give a medication before sending a patient to dialysis, I always either consult the drug book and I'll just call up to the hemodialysis unit and ask the nurse, this patient is prescribed this medication, it's only given once a day. Do you think I should hold this medication prior to sending them, or this patient has an antibiotic that's prescribed 4 times a day. Is it okay for me to go ahead and give the dose since the patient's not going to dialysis for a couple of hours? And they are usually very receptive to giving you information. If you're working in the home setting, you'll need to become familiar with these medications and also familiar with the physician or the mid-level provider's preferences regarding administering medications and taking the patient to dialysis. Remember that many drugs require what's called renal dosing or adjusted doses based on the patient's GFR and their creatinine. Refer to the learning management system for the course regarding nephrotoxic drugs. There are too many to memorize, so don't try to memorize those lists that I've given you. What I want you to focus on are the popular drugs related to medical types of patients. I want you to look at things like ACE inhibitors, antibiotics and antifungals such as gentamicin, amphotericin B, and vancomycin, which is one of the most popular medications, antibiotics given to patients going through hemodialysis or any type of dialysis. In particular, pay attention to NSAIDs, such as ibuprofen and naproxen. The pain medication article that I've given you is very important in understanding the impact of opioid medications and dialysis patients. There's also a great article on IV contrast and understanding the impact that IV contrast has on the body's natural renal process to excrete toxins. If a patient has altered kidney function and they're not able to get rid of that IV contrast, then they're going to have some intrarenal damage caused by that. And so you'll want to be sure to follow the physician's prescriptions related to treatment prior to receiving IV contrast as well as after. Other medications that might impact the patient's ability to dialyze or to metabolize medications are lithium. A common one that you'll give in the hospital setting is Lovenox and Pepcid. Again, refer back to the list on Blackboard for other popular medications. Don't try to memorize them, but understand the concepts behind why you would give a medication or why you would hold a medication. Remember that you're not alone. You can seek consultation from hemodialysis nurses. You can seek consultation from your peers. You can also seek consultation from the physicians and mid-level providers. They would all rather you consult them and ask them questions rather than provide a medication to a patient that would potentially be unsafe for them after or during the hemodialysis treatment, as well as negating the positive effects that were intended by the medication. I hope this has been helpful information to you, and I look forward to seeing you soon. Bye-bye.